Good morning. My name is Dr. Sean Price. I'm Clinical Director here at ChiroSpa, and I'm going to be putting a series of videos over the next few weeks. We're doing actually several series of videos over different conditions, conditions that we commonly see and help in our office. And today I want to talk about digestion issues. And like I said, we're going to be doing a series of these. But a lot of times patients will come in, and no matter what symptoms they're suffering from, chronic condition-wise, whether it's hypothyroidism, chronic fatigue, depression, even chronic pain, a lot of times patients, or diabetes or anything like that, a lot of times patients will come in and they will have gastrointestinal issues or digestive issues. And a lot of time that can be gas, bloating, constipation, a mixture back and forth, diarrhea. So we're going to go over how this happens, why this happens, and what can be done in the next several videos. So what I want to talk about today in our first video is going to be what we call SIBO, or small intestinal bacterial overgrowth. Basically, the small intestines should be pretty sterile. There should not be a lot of bacteria in the small intestines. It's the colon that we want to see, this proliferation of what we call the gut flora, or basically the environment that has all the good bacteria in it. The small intestines should not have very much bacteria in it. That's where a lot of our assimilation happens and our acquisition of nutrients into the blood. So small intestines are critical. Now, how can this happen? There are two primary causes that will cause the development of SIBO. The first is poor stomach acid. There is a very chronic use of proton pump inhibitors in our society. People that have acid reflux go to Prilosec, the purple pill, all these different proton pump inhibitors, Tums, so on and so forth. And the use of those, especially when you use them long term, can lead to decreased stomach acid. Or just simple age can lead to decreased stomach acid. But when you have that decreased stomach acid, then that leads to situations that we'll go into in just a second. And then the other one is poor gut-brain function. The gut and the brain are intimately intertwined with each other, and through the different nervous connections, if you start having decreased gut function, you will end up with decreased brain function, and then vice versa. Same thing goes with if you have decreased brain function, you'll end up with decreased gut function. So these are two of the main causes for SIBO. You also have food intolerances and things along those lines that can lead to problems with this. Now, if you're eating certain foods, so for example, you have sugars, you have which is obvious, your candies or things along those lines, but also simple carbohydrates that convert into sugar in the blood can cause issues. Galactans, those are like your beans and your lentils. Fructans, those are found in your cruciferous vegetables like your broccolis and your cauliflowers and things along those lines. And then your starches, which we all know, your potatoes and your grains. Eating these things with poor stomach acid can lead to them hanging out into the digestive tract longer than they should, which will make them start to ferment. And that fermentation will allow for bacteria to begin to develop in the small intestines. And when you start developing that bacteria in the small intestines, you'll get into gas and bloating after you eat. So that's one of the first things that you'll know is if you that could lead you to think that you might have an issue of SIBO, again, small intestinal bacterial overgrowth, is if you have gas or bloating after you eat. Now, sometimes this gas can convert into, you'll turn it into hydrogen gas, which will lead you to diarrhea, or you may convert into methane gas, which goes into constipation, or you may end up having both, which would be an IBS type situation. So I hope this makes sense. If you have any questions about it, please feel free to post below. And next week we'll go into another subject. And let me know if you guys have any subjects you'd like me to cover. All right? Have a great day.